Due to the unique characteristics of the scorpion venom, Escozin has a lethal effect on tumor cells, while leaving healthy cells completely unharmed. In Medolife Corporation, scientist Estefania Florez conducted a preclinical investigation on the anti-tumor effects of Escozin used on various cancer cell types.
At first, I could not believe that there was one of the peptides inside the Escozin was chlorotoxin, and that this scorpion venom actually attacked only tumor cells, and it left healthy cells within the human body untouched. So I did some investigation on my own, and I found out that what it actually is targeted is the MMP2 proteins, and those MMP2 proteins are upregulated in only cancer cells. So that's how I found out that that this chlorotoxin only goes for those cancer cells.
Dr. Eric Trabulэй is a prominent scholar in regenerative medicine and stem cell research, with extensive experience in molecular genetics and previous research projects with the U.S. Navy and NASA. Dr. Trabulэй, who is currently working at Medolife Corporation, explains Escozin's simple yet brilliant mechanism of action.
MMP2 is upregulated in all cancer tumors. So Escozin can work for all cancer patients. We have observed 4 peptides. These peptides are what we call voltage-gated inhibitors. So we have a chlorine inhibitor, potassium, sodium, and calcium. Now these peptides work as channel inhibitors. So in a cell has these gates, which ions are able to go forward and backward through these gates to maintain pH of the cell, homeostasis of the cell. When we have disease, the Escozin comes in, and these voltage-gated channel blockers block those gates so that the cancer cell now cannot maintain homeostasis and is forced to die a cellular death that we call apoptosis. Escozin blocks angiogenesis. What does this mean and how does it happen? Angiogenesis is the formation of blood vessels. That is a requirement of all tumors. They need to grow, they need to spread and metastasize. So Escozin blocks that operation of angiogenesis. How does it do it? Well, there are several ways that it is accomplished. One is by the peptide inhibitors blocking the ionic channels in the cancer cell. This is like suffocating someone. They are unable to maintain the homeostasis and osmolality of the cell, and eventually what happens, the cell ruptures. So this leads to a reduction in the size of the tumor and eventual death of all the tumor cells. Patients who had a resistance to chemotherapy, when they were introduced to Escozin, showed positive effects, and that the Escozin and chemotherapy worked together synergistically, and in some cases led to complete destruction of the tumor. Our research indicates that Escozin does affect neurotransmitters. And these neurotransmitters are the GABA receptors. Once these receptors are inactivated, pain goes away. Escozin does reduce inflammation. The mechanism is similar to the use of a non-steroidal medication. Our preliminary findings indicate that the sodium peptide blocks the sodium channel on the cancerous cell. This prevents the production of cytokines, which increase inflammation.